So basically this is a talk about kind of ED nurse and ED satisfaction. The reason I give it and I kind of feel very obligated to give it is the length of time I've been here and worked at this facility. It's actually the first place I came out of residency. So I came right from residency to Lincoln Medical Center, which was a 9-bed ER seeing about 17,000 patients a year. And I've had my family here. Actually, my youngest son, Brody, was actually born at the old hospital. And my older son was in a commercial for the hospital. If you ever seen the one of the kids swinging on the swing, that's my kid. So I did a commercial for the hospital, and so I kind of have a, it's like my home, and it's my family, and not just my family, but you guys are my family too. And so I kind of feel an obligation to help out and give back. And I think that we're a very unique emergency department. We're still a very rural emergency department, but we're also in a county that spans million-dollar homes on the lake and cornfields and single wide trailers on the west side, and all those people come to the same emergency department. And I think we have to recognize our own bias based on where we're from or where we grew up or where we live now that we carry for these patients. And so just want to give a talk. I think if we understand that, we have a better feeling of what we're doing and why we're doing it, and it makes it an easier day. I like working here. I mean, I really enjoy working here, and lots of my partners are like, I can't believe you're still there 20 years later. I'm like, I like working here. I like the patients. I like the staff. I like being the only game in town, and I think that's why I've stayed so long and haven't burned out yet. Like medical directors are supposed to burn out in 5 years. This is my 19th year, so I've been here a little bit of a while. So thanks. So I think the first thing we have to understand is who our patients are. In Lincoln County, our patients are not all, but we have a very big amount of poor, uneducated patients. And so a lot of these people don't have another resource. They don't have another way to get their medical care. And so we are the only thing they have. They don't have insurance. They don't have primary care doctors. And the one thing we don't have is we don't have clinics. We have helping hands, but it's not like you free walk-in clinic like downtown Charlotte. We just don't have that here. And so sometimes we are the only thing they have. And I think we have to recognize that's why they're here, is because they don't have an option. We also have a very uneducated population who just don't understand medicine. And I will tell you, even educated population, if they're not educated in medicine, they don't understand medicine. I mean, I have a cousin of mine who's convinced that a doctor 20 years ago missed her appendicitis because he didn't feel that she had an appendicitis on his exam. And I try to explain to her, I'm like, well, they didn't have CT scans back then. And she's like, no, he examined me. He should have been able to feel it. I'm like, we can't feel your appendix. But she's a CPA and was convinced that and like, she's like, for 20 years, I thought this guy like screwed me up. And he really just did the normal thing. And so people just don't know sometimes, and so they're coming because grandma said, if you swallow that pus from your tooth, it'll go to your heart and you'll get like a valve problem from a toothache. I mean, it's all expounded, right? You do get valve problems from teeth infections, but it's not from swallowing the abscess drainage. But they're uneducated, they just splice these stories together and in they come. And so sometimes we just have to help them through that and understand, sometimes they're just here because they have no idea or nowhere else to go. I'm convinced someday someone's going to show up with a flat tire just because it's an emergency. I need my tire fixed. They didn't know any better. It'll happen someday. We've intubated a dog at the old hospital because they brought him in because he choked out a piece of steak. And so Dr. Pontes took some Kellys out there and pulled out a piece of steak and put a tube in and transferred him to the Hickory Emergency Hospital, that hospital. So that's what we get, dog in the back of the truck, At the old place now, we're in a much nicer setting. I don't know if that would still be allowed any atrium way, but Lincoln Medical Center did it. The other people we see are obviously the injured people. So people have some sort of traumatic injury. We're the one-stop shop. No one else takes them. The urgent care, I guess, is very, very minor. But if someone's hurt, they're coming to us. They just are. That's what they expect. That's why we're here. And then the general sick people, which, if you've noticed lately, are a lot more than there's been. I think that's probably partially because the insurance plans have gotten to where like all the deductibles are up front, and so people aren't going to the doctor anymore. So the plan was we're going to give people insurance and they'll all go to their doctors, but they don't, because now they're all high deductible, and so all they've done is pile more sick people into the ERs, and so it's actually going backwards. Our volume's a little bit down, but our acuity is way up. So we're seeing less and admitting more, which means percentages through the roof, and so we're seeing a lot more sick people. And I think we've done a really good job over the last, how long we've been here, 10 years? And people like it here. I mean, people want to come. I mean, this is a trusted place in the community, and the old hospital didn't used to be that. And so people who used to go to Gaston, go to Fry, and go downtown, they're coming here. And good for us, but that's who's coming, and we have to expect that cross-section of people and understand when you go see your patient, like you can put them in that category, one of those 4 categories or a combination of those 4 categories. I think if you can do that, it makes it much easier to take care of people. Like, so what? It doesn't make sense that you're here. Ah, you don't have a resource. Oh, you don't understand. Oh, you're injured. And yeah, maybe for us that injury doesn't mean anything, but for them, they don't know. And so I think if we can put people in those 4 categories, right when you walk in the room, if you can find one of those 4, you're going to feel better about why you're caring for them. So the next one kind of goes through that process, right? So, what are they here for? They're injured, they're sick, they're in pain, or they don't understand. So if you can put them in one of those 4 categories, then you can try to do one of the things that they need, right? And so people are here because they're injured or sick, or they don't understand what's going on. So my attending, way back when I very first started as an intern, told us this. People are here for those 2 reasons, or a combination of both. And if you don't do something to fix that, you didn't do your job. If you didn't explain what's going on with them, or help with their pain, or help with their illness, you're just not doing your job. And so if you can get them into one of those kind of previous 4 categories, then it makes the other thing very easy to do. Oh, you're injured, we'll get an x-ray, it's not broken, we'll splint you up, get you your referral you need. Oh, you can't afford your blood pressure medication because you're on something that costs $100 a month. Well, we can get you to something on the $4 list. You're really just here because you can't afford your medicine. It has nothing to do with whatever story you use to get through the door to get here. They'll come in with chest pain and short of breath and all that, and when you really talk to them like, oh, you can't afford your blood pressure medicine. That's really what we're dealing with. Let's find you a resource to do that. And so if we look and try to put them in, it's much more satisfying than arguing with them why they're not taking their medicine when you find out like, oh, you just can't afford it. Or sometimes now it's not that they can't afford their medicine, they can't afford the doctor's appointment to get the prescription for their medicine. So they got a doctor, but it's a $150 copay. And you're like, well, I would put it on my credit card. Some of these people don't have a credit card. And they don't have $150 cash. So they can't go just to get the prescription. And so you got to understand that and try to get them a better resource, or give them a prescription. Next. So the next one is, where are they being seen? We're an emergency department, right? Like, even us a lot of times don't want to be here. And we work here, get paid to be here. You can't imagine that any patient really wants to be here. Even the people you think are the frequent flyers, that you think love the emergency department, they hate the emergency department. If they had another way to get their narcotics that wasn't the emergency department, I'm certain they would go there. Like, they're not like, oh, I know, I'll go to the emergency department and wait 6 hours to get my prescription of illegal drugs. That's not why they're here. Like, this is their resource to get them. But if they had another option, we're not the best option for that. If they could go to a doctor's office or a pain clinic, wherever else they can get their stuff, they would do that. Because the emergency department's not fun for anybody. It's a long wait, it's people who are sick, it's exposures to illness. Nobody's happy here as a patient, nobody. They have to come here. So we have to recognize right away, no one's going to be happy when they're here. They're not coming here because they enjoy being here. They're coming here because of one of those things we talked about before. They don't have a choice. There's no other option for them. So we have to understand that. And even when they're grumpy and upset and angry that the wait times, understand that no one wants to be here. So we need to understand that, and understand, I think more importantly, they don't have a choice. If they had a choice, I'm certain they would go someplace else. And as you start to do more of the charge stuff, you find out when you call these doctor's offices, when the patients say it's true. They're like, no, it's $200 for them to come see me. Or the one we had the other day where they basically were telling them that our neurologist doesn't take ED referrals. And I called him, he's like, that's not true. It was like an answering service telling him that. And you're like, they never told you that. And so we tried it, we called it, it's absolutely true. That's what they told me as well. So people just don't have a choice, have a reason to be here. So when do they come? So basically 24/7, right? But why? Like I see it all the time on the tracking board. You know, Smith is in Jones, 19 and 20 together. And you know, all those people came in the same van. Well, the implication to that, when I see it on the board, and I think the implication to that when people put it on the board isn't like, well, they're family and friends. The implication is they're trying to get something from us because they all showed up together. So I started like asking these people, like, why are they actually here together? Why does a van of 4 people show up all at the same time, unrelated to each other? Not cousins, not brothers and sisters. Like, why are you with so-and-so? Oh, well, I've been sick, and my neighbor, who lives in the same community as me, was going to the hospital, and they asked other people, do you need to go? Because they don't even have enough gas to get here. So there's like 1 car with gas in it in these like project type communities, and they're actually doing a service for their community, and we're railing them for it. They're like going around saying, hey, I have to go to the hospital. Does anyone else need a ride to get whatever thing they need from the hospital? And so they load up in 1 car and come here with multitudes of complaints, unrelated to each other, unrelated to the same complaint, because they're actually doing a service for their community as being a taxi ride to get them to the hospital. It's crazy. And then we're like implying that they're here to get something from us. It's backwards. And if you really, really talk to them, you find out why they're here. You know, why are you with so-and-so? Well, here's my ride. I've been sick for a week. I just couldn't get here. I would have came 3 days ago if I could have. I just don't have the gas. And we just don't live in that world where $2 a gallon is that big of a deal. I mean, it was a lot worse when it was $5 a gallon, man. It was like busloads of people coming in at the same time because it was the only way they could get here. The same as ambulance rides. You know, sometimes we're like, oh, you know, came by ambulance for an earache. Like, put them in the lobby, triage them out front, even though we got a bunch of rooms. But like, let's punish them for taking an ambulance for a minor complaint. You know what? They might not have an option. Like, it's the only way they can get here. Like, that's it is a cab service to them, but what's their other choice? You know, they just don't have another choice sometimes. 24/7. So why do they come in the middle of the night? Why does the 3-year-old come in the middle of the night with an ear infection? Like, what are you doing with a 3-year-old up at 3 a.m. with an ear infection? Well, mom works mid-shift. She just got home. And so when she gets home, she takes the kids and they go grocery shopping because it's the only time she has to take them grocery shopping, and now he's complaining of an earache. So she takes them to the hospital because that's their daytime. Like, and if you talk to them, you find out like kids wait for mom to get home, they do their family stuff. The kids, you know, they're young, they go to bed at 5 a.m. and sleep all day when mom's sleeping because what's the option? Have your kid awake all day while you're trying to sleep after your night shift, and then like you have to live as a family. And so they come at 3 in the morning because that's their daytime if you're a mid-shifter. And these mills all have this mid-shift life where they live their work life backwards to everyone else. And then their kids live it backwards everywhere else until they finally get into school. So that's why these kids, like, what does your kid got a cut on his head at 4 in the morning? Like, what are you doing at 4 in the morning? Your kid gets cut. Let them lie awake. It's the middle of their day. They're playing like any other kid would play at 4 in the afternoon. So that's why they're here. We need to recognize people's different time scale instead of just implying like, how dare you have your kid up at 4 in the morning? This is ridiculous. Well, you're day shifters, you guys. You know, ask the night shifters when their kids are up. It's completely backwards. You know. Recognize. So why did we decide to do this? And I think physicians, PAs, APPs, nurse practitioners, nurses, everybody's the same, right? So why are we doing it? To help people. I mean, that's really like, I don't think anybody really decided to go to nursing school, provider school, you know, APP, whatever you are. I think we all decided we wanted to do it to help people. So we need to help them. We need to put them in our 4 categories and then help them, right? Educate them. If they don't understand the illness, if they don't understand you can give Tylenol and then Motrin 2 hours later and then Tylenol, like help them with that process. You know, assure the follow-up. You know, don't just assume they can have a doctor, or don't even assume that they can actually afford the doctor. Like make sure, like, so is there a reason you didn't get your blood pressure medicine? Because there's cheaper versions, or I'll write you a prescription for 6 months until we can get you into helping hands, whatever it takes. I don't care. Like, we gotta help them and assure their follow-up. And then make sure we're understanding what the reasons are. Like, why did you really come? Sometimes you have to ask them, like, why are you really here? And then they kind of, there's more things. Sometimes it can like explode into something we don't want to deal with, but in the end, it's still helpful for everybody else. And then, you know, we all knew we were going to take care of sick, injured. You know, that's really what we think we want to do, right? We only want the sick ones. You know, I can tell you that I'm happy seeing like sprained ankles and sore throats and stuff. I mean, I had a time in my life where like putting a chest tube in every patient seemed like a great time, but I mean, Jason was at Northeast. Like, it gets old after a while when every single person is dying around you. Like, tertiary care centers are fun for a while, but just watching people like just crash and burn around you all the time, you know, I'm happy when I saw a couple code strokes this morning, which was great, but still like the kid with the sore throat in between. Like, you know, I mean, when we did some real stuff today, you know, we had a lady got TPA and got her vision back. It was great. Mm-hmm. There's enough of that here that we see enough of that sick stuff. I'm still happy to see some of the not sick stuff that we think shouldn't be here. And then the last one, right? Money. I mean, it is a job. I mean, we all, although we thought we came for the first two things, like in the end, it is a job, right? And so that's why we're here. And that's the one that I think we, you know, even if you don't agree with the first two, everybody agrees with the last one. And so we shouldn't complain when people come in a lot, because it's why you have a job. Like, you all are charge people. Like, what happens when there's not enough patients? We start cutting people loose. You know, and then, you know, the OR crew is upset because there wasn't enough cases. They're all getting sent home. The floor nurses are getting sent home. They can't pay their bills. Like, we should be happy that people keep using the emergency department. Like, it's a great job. And now there's a lot of respect that comes from it. Like, people really like us. Like, you wear your badge out, people are like, oh man, you work there, that's great. But, I mean, you're driving a nice car, you live in a nice house. Why? Because people show up at 3 in the morning with earrings. If they didn't, we'd be done. Like, if everyone got smart tomorrow and only used the ER for ER stuff, there'd be a secretary, 1 doctor, and a nurse, and that would be all we would need. We would truly be an ER, not an ED. We'd be an emergency room, not an emergency department, because we would need 1 room for the amount of sick people that really, what's our acuity, Nick? 15%-ish, right?
Yeah.
All right, so 15% need to be admitted. Let's say another 10% are traumas that you say probably need the ED. All right, so take 75% of our volume away tomorrow. How many have a job? We're not working here anymore. There's no way. So, like, if you can't get through the first two that say, like, I'm here to help people and take care of sick people, at least understand, like, they're paying your bills and you're driving a super cool car and stuff, because people show up and probably don't need to be here. And, you know, if that gets you through and you're nice to people because of that, you're like, hey, thanks for the new car. That's good with me too. Like, you know, understand those processes, right? Next one. So my last one is really kind of more of a interaction tip. So these are the kind of the things that kind of twist me a little bit, and I think a lot of physicians. And so, you know, and you'll hear me say it, you guys have probably all heard me say it, like, be a nurse, don't be an order taker. Don't just sit there and wait for orders to show up on your computer so you can go do them, right? Anyone can look at a computer and go draw 5 cc's of something and take it in the room. Like, that's, be a nurse, you know, like, go in, assess patients, make decisions, put in orders. You know, you guys know me, I have no issue with like, oh, you did what? Sign, you know, like, like, be okay with that, you know, drive the train forward. And that's, I mean, the more we do that, the better you get at, the more trusted you are. If you got a question, ask, you know, and that's the next one. I don't have any problems with someone asking me a question about what I'm doing. Well, why would you do this? Why would you do that? When I have a problem is when you're saying, why are you doing that? You know, there's a difference between questioning the care and having questions about the care. And so having questions about the care is okay. Questioning the care, that gets a little bit dicey sometimes. And it can be a fine line, I agree. But, you know, if I order 100 milligrams of Norcuron and someone's like, you sure you want 100? I'm okay with that one. If I write some pain medicine for someone, they're like, really, you're giving that guy pain medicine? That's kind of a decision that I get to make, you know, and we see it and we hear it. And there's lots of times where people will tell me like, oh, this guy's here for back pain. This is his 10th time. I go look in the job, I'm like, he's never been in this hospital. Oh, it must have been somebody else. Yeah, but you just implicated that guy as being some drug seeker, and then you implicated me as giving him drugs to a drug seeker. Like you got to understand what you're saying, you know? Like the whole version of, oh, Dr. Thompson, this guy's requesting you. I understand what that. I understand what the implication of that is. That like somehow I'm giving him stuff, and that's why he likes me. Sometimes they're my neighbor. I've lived here for 20 years. That's why, or I've seen them 100 times, or they're family members. Because after 20 years, I've seen like 100,000 patients. Like I know these people, and so yeah, they do know me, and they do like to see me or take care of me. Sometimes, the one time the other day, they were like over Christmas time, it was like, this lady really wants to see you, and there was all this implication. You know what she had? She had a Christmas present for me. She made me something in Davidson Behavioral Health, by the way. She made me some gift in the art class while she was in there for her schizophrenia, and wanted to give it to me. And that's the only reason she wanted to see me, but the implication was somehow I was going to give her something. Drugs, right? And so that's the kind of the words matter part, isn't, you know. The other one that I hear sometimes that I think that even the doctors do at times was when the shift changes, you're like, oh man, so happy that you guys are here, right? Like the implication is that is like maybe, like if the night crew came in, I'd be like, oh man, finally nights is here. That's like saying the day crew didn't do their job. You know, or like if I come in, you're like, oh, Dr. Thompson, it's so glad that you're finally here. Like that's telling the guy next to me, like, who was working all day, like maybe he wasn't pulling his weight. And then maybe that's not what you mean by it, but that's sometimes what's heard, you know. And I hear it from the docs too. You're like, oh, finally, night shift got here. Like, really? Like, I don't know if everyone's hearing what I heard, but that means like maybe they're here to bail us out. Now, sometimes you're saying it because we're getting overwhelmed and we're all happy that anyone's here to help us. But be careful who and what you say it around, because you know that adversarial stuff. We do a good job here, I think, of not having that kind of problem. But we got to be careful, and now we have a lot of new nurses, and so we don't want to set up that that as a normal, that it's okay to complain about each other, because I just don't think it works well. Last one, World Championships. So me and Jen and my older son are the only family in the world to ever qualify for the same World Championships at the same time. And we all medaled. And we're going again to Japan this year for the same thing. So we did it twice in a row, which is pretty good.
So it'll be 4. So it'll be 4.
Yeah, he's there. He started lifting. The littlest one started lifting, and he's actually stronger than the older one.